what are the common medications for Alzheimer's disease? Alzheimer's disease is the commonest type of dementia.
There are common medicine for Alzheimer's disease, but we must bear in mind it is not a cure. Also, when we talk about medication for Alzheimer's disease, are we talking about the improvement of memory or a slowing down of their memory deterioration? Or are we talking about the emotions of the Alzheimer's disease or the behavioral aspect of patients with Alzheimer's disease? So common medications used for Alzheimer's disease very often can be the behavioral part, because if the person having no memory, it doesn't disturb people. But if the person had Alzheimer's disease, start to take water from the commode and use it as water for everybody to drink, or you start to smear fecal material on the switches. So we're talking about common medication, whether for the memory or for the behavior or for the emotion. So there are different aspects. But we know for a certainty, there's no cure. There's no cure for Alzheimer's disease. If a person can determine that, then they will get a Nobel Prize. Currently, there are two big classes of drug for treatment. They call that treatment prescription drug for Alzheimer's. And one is a big group called acetylcholine inhibitor. It's a big word, and there are examples. Then there's another big word, MMDA antagonist. The example is memantine. We want to make it simpler by having a picture. Is it okay to have a picture? Next slide. Okay. So you and I, all in the audience, 300 people, we all have neurons in the brain. Our brain talk to each other, and we require this chemical called acetylcholine. You can see the acetylcholine is the yellow and the green thing. We need the acetylcholine to communicate to each other. But very quickly, this acetylcholine is broken down by this component called acetylcholine esterase. You can see the fork going around to break it down, it chopped it up. So this chop it up enzyme is not nice. So it developed a drug, acetylcholine esterase inhibitor, to stop this from chopping up the acetylcholine. That's how it worked. This drug that has been discovered to chop up this enzyme so that it doesn't disturb the acetylcholine. That's how this drug works, okay? Next, for the severe dementia or moderate to severe dementia, it's called memantine. Again, it's a wonderful discovery, and we are still continuing to research to find out more about this drug. But it is a fantastic chemical because when the two neurons talk to each other, another chemical is called glutamate. But too much glutamate is no good, but too little also no good. So we all need a right proportion of the glutamate in the brain. We need the right proportion. And memantine, as the slide tells you, it can keep the amount of glutamate. We call it modulated. It's so fantastic. It goes to the neuron, in between the neurons, regulate the amount. So that is to treat. Again, when the word treat, it is sometimes to delay the memory decline of patients with Alzheimer's disease.
Are the medications for all the degrees of dementia? I think, Prof. Tan, can you just repeat what you have said so that people understand all this?
Okay. So Prof. What earlier I mentioned, there is a condition called pre-dementia, mild cognitive impairment. So some people take ginkgo. But for the treatment, the doctors, the physician, the geriatrician, they want to delay. They want to make the memory decline slower so that the physician treat with drugs. So for mild and moderate, they use the acetylcholine esterase inhibitors. For the more severe one, moderate to severe, they will add on from esterase inhibitor, add on a memantine, so become two drugs. When you start this medication, Professor Kwa also these patients, when they come back after taking these drugs for, to improve their memory, we have this whole list of side effects. But what is common, we want to tell them, if it affects their sleep, Then we want to give them in the daytime. But if you make them lightheaded, then you tell them when you change your position from sitting to standing, a bit slower, go a bit slower. If you suddenly stand up from a sitting position or lying position, it may fall. Same as for drowsiness, headache. So some of these things we have to be careful. But by and large, they can go away after a while. We call it tolerance. A person develop tolerance. If they have it, you need to tell your physician so that they know how to adjust the dose. Sometimes related to the dose. Nausea is quite often, so you tell them to take with food. Don't take empty stomach. When you take with empty stomach, then the nausea is worse. So these are little things that we can tweak. If there's constipation, there's diarrhea, then we have to tweak from there. Constipation, we drink a bit more, take a bit more liquid. But if they have diarrhea, then we tell them how to adjust their food and diet. So these are common things, but it can be adjusted. The dose can be adjusted and tell them what to do with the side effect.